Hello, everyone. I am Dorothy Guerrero. Welcome to Global Justice Now interview series, Southern Perspectives on the Coronavirus Pandemic. In this collection of interviews, we focus on bringing views from social movements and progressive groups from countries in the Global South that are mobilizing and addressing the pandemic. It has been 5 months since the novel coronavirus or COVID-19 appeared, and it has now spread to nearly every country since it was first diagnosed in early January. For this interview, I will focus on the challenges it is posing to the Democratic Republic of Congo, where the first confirmed case was reported in early March. This Central African nation is facing deep problems. Its health system is crumbling and overwhelmed. Before COVID-19, it already faced an onslaught of deadly diseases in recent years, including measles, polio, malaria, and Ebola, on top of another deadly enemy in the coronavirus. Very few tests are conducted in the country so far. There is only one laboratory that can analyze test samples in the capital, Kinshasa, which has a capacity of executing 100 tests per day in a population of 80 million. Today, I am talking to Salome Elolo from Femme Solidar, or FESO. FESO is a coalition of 24 women's groups from across the DRC, which is advocating for equal energy access and the democratic participation of women in Congolese society. Hello, Salome, how are you?
I'm fine, Dorothy. Thanks for having me.
Yeah, and thank you for agreeing to this interview. Well, as you can imagine, the coronavirus pandemic is also impacting a lot in our society here in the UK, but we could only imagine how it is impacting your society. So can you tell me more about the situation in the DRC or also in Kinshasa where you are right now?
Yeah. Well, the situation in DRC, mostly in Kinshasa, it's getting worse and worse every day. Only because from the start, the government did not take precaution measures like communicating with the population and explain to the population what is the coronavirus. So from there on, everything went badly. So we have that the majority of the population in Kinshasa does not believe that the pandemic really exists. So now the government is trying to take the sanitary measures by sending police officers in the streets to control people if they're wearing masks. But that also is going badly because the police are taking opportunity to harass people. So when the police officers see you without the mask, they send you to pay a fee that is very higher that the people cannot afford. And all of this, the government doesn't see it that way. So having the poorest country in the world and people, they have to buy their own masks. That means they don't have money for that. And if they're not wearing the mask, they have to be charged an amount that they cannot afford. And from that on, the government took precaution measures only to protect the high society. That means only the town that is on lockdown. Apart from the town, everyone else is free to do whatever they want. So that is some of the reasons why the numbers of the contamination are going up and up in Kinshasa. And also around the other province, we also have the same similarity because people, they don't believe in this pandemic. They are saying it's not serious. The government just wants money from the international NGOs. So all of this, the communication really did not go well from the part of the government ever since the pandemic started.
Mm-hmm. If you give us an idea as well how it is affecting not just people in Kinshasa but also in the other provinces, but also what is the difference between the impact of this coronavirus or COVID-19 compared to the previous epidemic or the previous sickness that visited the country? Like, for example, if we talk about Ebola, I know that Ebola is not completely eradicated yet, and now you have the coronavirus.
Yes, yes. So it's very different with Ebola, because when we had Ebola in DRC, it was in a specific only territory, like East Congo. So having the coronavirus, the spreading of the coronavirus is very dangerous, even on the spreading of Ebola, because with the corona, it's like it does not choose where. Everyone can have it and get it. But with Ebola, it was like, okay, there is Ebola in DRC, yeah, but Ebola is in East country. So you know the Pacific territory where you can find Ebola. But with the coronavirus, it's different. It's everywhere. You can't say that I'm going to Congo, there's no Ebola, there's no coronavirus, for example, in Kinshasa. But no, there is in Kinshasa, there is everywhere across Congo.
Mm-hmm. Can you tell us in terms of your work? So you're organizing. You normally have meetings. You normally go around talking to people. How is it affecting you now that that there is a virus?
Yeah, it affected us very, very bad, because I think most Congolese, apart from the people that lived in the war, that maybe they can understand being in a lockdown for 3-4 days, 1 month. But people that did not live in the war, they don't understand it. So psychologically, it's eating some of us, because you are just there. And our work is activities are on the ground, but now you cannot go on the ground. So we are trying to do meetings on the phone, and that is very, very, very hard, because our network also is very bad. So we are trying to do everything by the phone, and many people don't know how to do things on the phone, like holding meetings on the phone, talking on the phone. Most of people, they were born to just be on the ground. So this is their first experience, and psychologically it's eating them.
Mm-hmm. In terms of shifting or how people are adjusting, like in your case, or normally you are campaigning for access to energy and you're talking about climate and energy and just transition and those issues. Do you have to shift now that because of the crisis? Does it change the way your organization is campaigning?
Well, I cannot say that it has changed. It does not change, because we are still in fight for the same cause about the climate. Even now, when you see this past 2.5 months, going 3 months, you can see even the pollution, like in Kinshasa, has gone down, because people are not doing the same activities as they used to. So the work is still there, but it's not on the ground anymore. We are just on the phone, doing meetings on the phone and preparing our work, like preparation. When all this is over, we can just go on the ground and do our activities.
Mm-hmm. I'm interested when you say when this is over. So what generally do the movements there when you say that phrase when this is over? Are there initiatives to bring people together to discuss what do we want when this is over, or what kind of society do we expect when this is over?
Yeah, I think even now, even in the villages, now they know what they want when all this is over. Because with this pandemic, it's like an open eyes into our government. Like they need to see that we need hospitals, we need electricity, we need water. Because before the pandemic, it was like a minister is sick, he has to go to Europe to get health care. But now with the lockdowns around the world, minister is sick or a president if he has to be sick, they have to go to the hospital. But which hospital? That now I think they are they are seeing the importance when all this is over. The first thing they should do is to bring power, water, and hospital. When I'm talking about hospitals, that means with all equipment. Not hospital, just it's built and you call it hospital, but inside there's no equipment. So I think many people now have they have opened their eyes to be prepared, because maybe this is the phase one. What about phase 2 when it will come? We don't have hospitals. We don't have any equipment in our hospital. Can you imagine even the respiratory machines that we have? It's not even to all the country, not even enough only for Kinshasa. So I think maybe this is a lesson into our government.
Mm-hmm. And how are the people coming together? Are there alliances or coalitions between groups like yours, women's organizations, and also trade unions, students? Is there something like that happening?
Yeah, we are doing alliances for because we need power, doing alliances for hospitals. So we are united and we are trying to bring up something that maybe we can follow up if the government is going to respect their promises.
Mm-hmm. I think these last two questions is also important. I brought it at the last, but I think this is also something which is important to know from groups here. Do you have any message from organizations here in the UK and globally?
Yes, thank you so much for that question. So what I can ask for the organization around the world and the UK is to have solidarity in action. When I'm trying to say solidarity in action, that means what? Because DRC are receiving a lot of funds from the international NGOs. Mm-hmm. So we need help for other organizations around the world to follow up, where the money is going. Is it used well to do something good for the people? Because today with the pandemic, we don't have hospitals. After the pandemic, will they use the money to build hospitals with equipment? Will they give people water? Will they give people electricity? Will they be there? So if we can have that solidarity with other organizations to follow up, so if the international organization can make it a noise, it can help us, because in our country, the government is very afraid of what News International is saying about the country than what us in country inside we are talking about the country. So if we can have that solidarity, it really can help our country to move forward.
I think that is a very crucial message, Salome. Thank you very much for being with us and for saying your important message. And take care.
Thank you. Thank you, Dorothy. Thank you so much. Okay, thank you.